Most people with type 2 diabetes, particularly those who are not taking medications to control their blood sugar, the research indicates that intermittent fasting is both safe and likely to be beneficial. The risks of fasting with diabetes: if you do have a hypo during fasting, it is important to break the fast and treat the hypo with your usual hypo treatment. If your blood sugar levels become too high, this could lead to diabetic ketoacidosis, DKA, which would require hospital treatment. It is recommended that during Ramadan, the pre-Ramadan basal insulin dose should be reduced by 20% when given in the evening. When taken at iftar, a further reduction may be needed, up to 40% of the pre-Ramadan basal dose. All individuals with diabetes who are fasting during Ramadan should be advised to break their fast if blood glucose less than 70 mg per deciliter, 3.9 mmol/L. Advised to recheck within 1 hour if Bg is between 70 to 90 mg per deciliter, 3.9 to 5.0 mmol/L. Blood glucose greater than 300 mg per deciliter, 16.6 mmol/L. New study finds intermittent fasting style diet can cause type 2 diabetes remission in just 3 months. A small study showed people with diabetes could achieve remission and stop taking medications after following a restricted calorie diet on certain days of the month. What do diabetics do during Ramadan? What is the pathophysiology of fasting in diabetes? Patients who fast, especially those with type 1 diabetes mellitus, T1DM, are predisposed to excessive glycogenolysis, gluconeogenesis, and increased ketogenesis, resulting in increased risk for hypoglycemia, hyperglycemia, diabetic ketoacidosis, and dehydration. The Quran requires Muslims to fast during the month of Ramadan from sunrise to sunset. However, there are exceptions to this. One of them is that people who are ill or have medical conditions do not have to fast. This can include people living with diabetes.